Congratulations on the birth of your baby. Now that you have had your baby, this video will give you important and useful information. A community midwife will visit you at home the day after discharge, usually between 9 AM and 5 PM. Please confirm your address before leaving hospital and let the team know if you won't be home. If you haven't heard from them by 3 PM, call your community team. Community care may include home visits, phone calls or clinic appointments. Prior to discharge, ensure the baby's car seat is safe before driving. Always use a properly fitted car seat for every journey. Never leave your baby alone in the car. Legally, you have 6 weeks to register your baby's birth. For more details and to book an appointment, please access your local government website. You will also need to register your baby with your local GP surgery. Please book a routine 6 to 8 week postnatal appointment with your GP for yourself and baby to make sure you are recovering well. Serious symptoms. Seek help immediately. Call emergency services or go to the hospital if your baby is floppy, unresponsive or difficult to wake, has trouble breathing, blue lips or pauses in breathing, has a high fever over 38 degrees for babies under 3 months, has persistent vomiting, severe diarrhea or blood in poo or vomit. Jaundice causes yellowing of your baby's skin or eyes. Mild jaundice is common, but seek advice if yellowing spreads or becomes darker, your baby is feeding poorly, unusually sleepy, or has fewer wet nappies. Early detection is important to prevent complications. It's important to be aware of your recovery. If you had a cesarean, your wound dressing will be removed as guided by your midwifery team. Keep the area clean and dry. If you have stitches, let your midwife know if they are painful or not improving. Bleeding can last 4 to 6 weeks, starting heavy and red, then gradually becoming lighter. Contact your midwife if you pass large clots or need to change your pad every hour. Shower or bathe regularly and change pads often to stay clean. Mild ankle and foot swelling is common. Resting with your legs elevated can help. Serious but rare conditions, call 111 or 999. Sudden, heavy or ongoing vaginal bleeding. Severe abdominal, pelvic or perineal pain. Fever, shivering or foul-smelling discharge. Pain, swelling or redness in your calf. Shortness of breath or chest pain. Breast pain or swelling lasting more than 24 hours, which may indicate mastitis. Severe headaches, especially with vision changes, nausea or vomiting. Having a baby can weaken your pelvic floor muscles. To learn how to strengthen them and why this is important, please visit Pelvic Health Physiotherapy Service, Bristol. Many unplanned pregnancies happen in the first months after childbirth. For more information on contraception, please visit Contraception After Childbirth. Your newborn needs to be fed at least 8 times in 24 hours. You should notice increasing number of wet nappies and poos each day. By day 5, your baby should have at least 5 to 6 wet nappies with pale urine and yellow poos. Poos usually change from thick black to green, and by day 5 should be yellow. If your baby is feeding less than 8 times or wet nappies are insufficient, contact your midwife. For more feeding guidance, watch these videos. Safe sleep. While sudden infant deaths are rare, they can happen. You can reduce the risk by always placing your baby on their back to sleep, at the foot of the cot so they cannot wriggle down. Keep the sleep space clear of loose items. Bed sharing is unsafe if you or anyone in the bed has consumed alcohol, smokes, or taken drugs or medication that causes sleepiness. Your baby was born prematurely before 37 weeks, or weighed less than 2.5 kilograms at birth. The ideal room temperature for your baby is 16 to 20 degrees. A simple rule: your baby usually needs 1 more layer than you would wear. Crying is your baby's way of communicating. Try feeding, cuddling, changing, or gentle soothing. If nothing works and you feel overwhelmed, it's okay to put your baby down safely and take a short break. If crying doesn't stop and you feel worried or overwhelmed, contact your midwife, health visitor, or NHS 111. Never shake your baby, as this can cause permanent brain damage. Babies must be kept smoke-free, as smoke increases the risk of asthma, infections, and hospital admission. If you smoke, always wash your hands and change clothes before holding your baby. Secondhand smoke can spread through a room even if you smoke by a door or window. For more information or local support, speak to your midwife. After childbirth, hormonal, physical, and emotional changes can affect how you feel. It's common in the first weeks to feel tired, tearful, low, or overwhelmed. If these feelings don't improve or become worse, speak to your midwife, GP, or health visitor so you can get the right support. Thank you for watching this video. If you have any questions or concerns about anything you have seen in this video, please get in touch with your midwife.